Hi, today I am going to show you the insertion and the removal of an indwelling catheter, as well as explain cath care and also collecting a UA specimen with somebody that has an indwelling catheter. The first thing I'm going to do is I am going to introduce myself to my patient. I am going to identify my patient by wristband picture and as well as verify their name if they can, if they're able to. I'm always going to explain my procedure and what I'm going to be doing. I'm also going to follow agency policy as well as state and federal regulations. I am going to practice good hygiene, good body mechanics, provide the patient privacy and safety, if necessary, and if the procedure is calling for sterility, then make sure that I ensure and maintain a sterile field. So the first thing I'm going to do when I walk in is I am going to, if I have a female patient, she is going to be laying in dorsal recumbent position with her legs out, her knees bent. For a male, I'm going to have him in complete supine position with legs kind of girded out, but they do not have to be bent like a female. I am always going to make sure that I apply gloves and of course explain what I'm going to be doing. I'm going to ensure good body mechanics and that the bed is raised to a level that I'm able to work with. In addition, I'm always going to make sure, especially with this procedure, that I have good lighting, that I'm able to see no matter what side of the bed I'm on. Since we are bringing down the blankets, we are going to make sure that we drape the patient's top half as well. In this case, I do have a female patient, so I am going to ask her to bring her legs out, knees bent. Before we start the procedure, we are also going to perform pericare, and that doesn't require the sterile gloves. But we are going to make sure and ensure that we do have gloves on. Okay, once we have draped the patient and we have done pericare and we have located the urinary meatus, we are then going to start our procedure of inserting our catheter. We are going to pick up our cath kit. We are going to maintain sterile field in this procedure as well. So we're going to organize all of our, we're going to wash our hands too, by the way, before we start this. Since we've done pericare and removed our gloves, we are going to make sure we wash our hands before we do start this. We are going to organize all our supplies, and we are going to find a clean, dry spot in the patient's room to do this. We are always going to make sure that this is in our reach, so we're not having to go away from our sterile field, turn away from our sterile field, or reach too far where we could possibly contaminate it. As well as we want to make sure that we have a trash bin receptacle somewhere nearby, so we're not also reaching across or doing anything to disturb our sterile field or just make our life completely difficult. In the beginning of this procedure, we are going to place our kit on the table. And the way of opening it is we are going to reach around. We're going to go away from us, away from the patient, towards the patient, and towards me. Okay, and we have to ensure that we are not touching anything on the inside of this. We don't have our sterile gloves yet. This is our sterile field. Put that far away from there. Okay, next thing we're going to do is we are going to take the drape out without touching anything else in the kit. We're going to move away from the kit. kind of let it drape. Shiny side down. I'm going to place it underneath the patient. All right, the next thing I'm going to do is go ahead and put on my gloves. So I'm going to take the packaging from the kit. I'm going to move away and around. I'm going to ensure that I'm not crossing my sterile field. I'm going to place them down, bring them out, ensuring that my hands are underneath the fold when opening and that it is not touching my other sterile field there. With my non-dominant hand, I'm going to go ahead and pinch the inside of the cuff away from my sterile field. And then I'm going to take these two fingers and go underneath and away. Thumb out. Okay. And that way I'm keeping our hands above our waist. Okay, so we are going to make sure that we organize all our materials, still ensuring a sterile field. If we need something over on the other side here, we're going to reach around and away from our sterile field, not over. Make sure that we're not turning our back and everything is within reach and our hands above our waist. We're going to make sure that we have our cotton swabs as well as our lubricant jelly. We are going to make sure that our syringe is already inserted here before we go ahead and proceed with the procedure. We can go ahead and we can take this and we can actually place it right in between the patient, right on our sterile field down there. Okay, so the next thing we're going to do is we are going to prepare for insertion. The first thing we're going to do is we are going to take our alcohol swabs. There are 3 placed in here. So the order of cleansing would be, of course, we would also start by spreading with your non-dominant hand. We are going to spread the labia open. Of course, locate again the urinary meatus. Then we're going to take an alcohol swab. Our first one is going to go to the labia minora. And then the next part, it's going to go on the near side of me. So we're going to go from, of course, from top to bottom towards the anus. And then we're also going to go right through the center. And we're going to make sure that we throw all of that out. We are still maintaining sterile field with this hand. We are going to make sure beforehand that we have lubricated the end of the catheter here. About 1 to 2 inches. And then we're going to go ahead and prepare for insertion. Holding firm, kind of a firm hold there. We're going to ask her to bear down and take the slow, deep breaths. And we are going to insert. And we are going to insert until we see some urine output flow through the tubing here, and then we're going to go probably about 1 or 2 inches just to ensure that it is up where it needs to be. Again, we are going to make sure that we are keeping the drainage bag still in our sterile field, still maintaining sterility with this hand. Once we have the insertion of the catheter, we are going to go ahead and inflate the tubing. If we do inflate the tubing and the patient complains of pain, just deflate the balloon in there and then commence again. So once we have done that, we can go ahead and inflate our balloon. And then we are going to remove this, throw it away. And then we are going to ensure that the drainage bag is on a non-movable part of the bed. We also want to make sure that the patient isn't laying on it or any of the sort where it's uncomfortable. We're going to make sure that we are throwing away all our things, that we throw away our gloves, clean our space up, wash our hands when we are finished, make sure our patient is in a comfortable position, call lights within reach, and that their bed is down. Okay, and to get to catheterize a male patient with our non-dominant hand, we are going to grasp the penis, and we are going, if they do have a foreskin, we are going to make sure to retract that. And cleansing with the cotton swabs, we're going to start at the meatus and go in kind of a circular motion, working our way down, even partially shaft to the penis. So we're just going to start in one circular motion and throw our cotton swabs out. Lubrication of the catheter needs to be done unless they have gotten, no lubrication is needed if they have received 2% xylocaine, which is actually injected into the meatus. So we are going to insert, still holding the penis with our non-dominant hand, insert the catheter until we get some urine through the tubing, and then we're going to go ahead and proceed maybe 1 or 2 more inches just to ensure that it's there. And we are going to deflate the balloon and then make sure that the bag is on a non-movable part of the bed. For a leg bag, we would uncap this, pinch this off, and just change it right through there. And we would put it on a part of the leg right about here, wherever it's kind of comfortable for the patient, as long as it's not pulling or tugging, and not too tight around the legs where it's cutting off circulation. We can also obtain a UA 2 different ways. A sterile, it has to be sterile. The first one would be our initial insertion of the catheter. We can get a UA that way through the drainage bag. The one thing that we're going to make sure that we do is that when we open the port, that we're taking an alcohol swab to the end of it and cleansing the end of it, and then we are able to go ahead and drain it into a sterile specimen cup. If the bag is not newly inserted, we are going to clamp the catheter right below the specimen's port, and we are going to take our needleless syringe, and that'll probably be done. They'll probably have to be cut off, clamped between 15 and 30 minutes. Then we're going to go ahead and stick our syringe in there, withdraw the amount of urine that we need, and then go ahead and place it into a sterile specimen cup. We want to make sure that when we do that, that we are not touching the sides or the walls, and we will just insert it in there. We're going to make sure that we label it with the name, date, the reason for it, the time, and then we are going to go ahead and send it in. We will make sure also that whenever we do that, we are cleansing with an alcohol swab as well, that we are making sure that the port to the catheter bag is closed, and that we are placing it on a non-removable part of the bed. We also ensure that the patient is back to a comfortable position and that their bed is lowered. For cath care, we always want to assess the tubing, make sure there's no kinks or anything of the sort. We want to make sure that this is not on the floor, the drainage bag is not on the floor. If it does get disconnected, we are going to take alcohol swabs to both ends and clean it off with the alcohol swab and put it back. We also want to make sure and ensure that the drainage bag is not above the bladder because that can cause a backflow of urine. Usually catheter bags need to be emptied 8 hours a day, sometimes PRN, depending on how much output that they have. When taking the output of a catheter bag, we are going to make sure that we take alcohol swabs before and after. We are going to unclamp it and put it in a calibrated measuring cup type deal. We're going to make sure that we also document anything, the urine, the color, the smell, and how much output we've gotten from them. Always make sure again that you put this on a non-removable part of the bed. Lastly, we are going to talk about removing a catheter. You're going to make sure, of course, that we're ensuring patient privacy. We're going to drape the top half of them. We're also going to make sure that we're washing our hands, applying our gloves. We are going to, depending on, there we go. We're going to make sure that we have a towel underneath. We can even do a towel over the legs. And then we can go ahead and start deflating the tube here. We are going to enter the syringe and we are going to withdraw the amount that is in there. If it doesn't all come out and we're having difficulties with all of it coming out, we're just going to ask the patient to kind of hold their breath and just take it out nice and easy. Don't pull it out, yank it out, just nice and easy. We are going to go ahead and make sure that all of this is thrown away, all our materials are thrown away. We can perform peri-care if necessary, make sure they're dry, make sure they're comfortable, back in a position where they're comfortable, the bed is down, and that we are washing our hands right after the procedure. After catheter removal, we are going to be assessing a few times after that. Once the person is independent to go to the bathroom, we are going to ask them not to flush the toilet. We want to assess the urine, color, odor. We also want to make sure that we are measuring that last urine that we were able to get out of the catheter bag, and we want to make sure that we want to document that.